Hello and welcome to Joy Wisdom Trust. I am Joy Wisdom. I am very passionate about women and children's health. I've been working with women in pregnancy, infertility, miscarriage for nearly 2 decades. I'm working with babies too, children's health, etc. I wanted to fill some of the gaps that our society has misunderstanding about or underestimates the amount of emotional fallout and trauma for women from miscarriage, infertility, and challenging births. I wrote my book in 2012, Pregnancy and Birth, A New Generation, explaining about a lot of this. I must say that postnatal depression, post-traumatic stress disorders have grown enormously since that time. And we had a huge numbers back in 2012. So we're really not getting to the core of this. And many women are suffering with grief, sadness, and inconsolable because of the issues that they've gone through, continue to go through, and causing mental and physical health issues. I want to bring this to a bigger platform and work with other charities, etc., to help to educate and to explain about the suffering that women continue to go through. My other big area here that I'm very passionate about is abuse. And abuse numbers have grown enormously. Again, in the 12 years since I wrote that book. And I did record a DVD, an interview DVD about abuse in 2014. Again, numbers have just grown. Nothing's changed. And unfortunately, we have a very apathetic view on this. We need to take it more seriously because it's costing us billions and trillions each year to support or firefight, from my point of view, women and couples. If we put a stop to it, there would be lots and lots of benefits financially as well as health-wise. I've got some slides to show you and to share with you. If you would like to support at Joy Wisdom Trust, if you have lost your baby in whatever way, please contact. We can help with education, guidance programs, but also therapy that is going to help you to move on and get your life back. Don't live this. Please move on, because health issues will follow. Joy Wisdom Trust. It is a new launch. The logo here is the seed of life, processes of that seed of life that happen to us on a physical, energetic level, and the development of consciousness, etc., that goes into that. Very poignant for the subject. In the last few days, we've had Women's International Day. From my point of view, we really need to upshift on women's care. With Joy Wisdom Trust, we'll be filling in the gap and inspiring women with a new era of healthcare options, bringing new understanding of PTSD, PND, emotional trauma, and the support programs to help improve well-being. Certainly, we've come a long way since the suffragette days, but we still need an awful lot of acknowledgement of women. Not a lot has changed in 12 years in supporting women. The ongoing health decline is evident, and the cost to society is billions. With firefighting, ongoing disorder results are inevitable, and the apathetic attitude is strong in society. Humanity needs change to bring a bigger platform of understanding. What we don't seem to understand is emotional issues go hand in hand with mental health and mental health decline. Emotional issues will also cause physical health decline. If we don't deal with the emotions, it drives the other two, the decline, the internal decline, because again of peptides, chemicals, hormones, things will decline. And it does affect the DNA. It does affect our cells and how healthy we are or not. We've come a long way since suffragettes called for equality. Benefits have been massive through the decades. However, we still have a long way to go. Abuse is worse than ever, with 1 in 3 women are now abused. Our rape and domestic violence remains high, and women and children have their personal story of fears. Birth trauma, IVF, miscarriage, devastation, termination, and stillbirth will create emotional distress and remains undersupported. Each woman has her own distressing story from losing their baby. All needs to be heard, and solutions to help them move on. The fallout is misunderstood. The shock, the grief, the PTSD, physical issues go on to cause future health disorders, are continuing undetected, underestimated, and ignored. Slave trade, people trafficking continues to exist. In Honduras, it was highlighted this week that girls of 12 are pregnant, a common theme of rape in their culture. India and Pakistan rape is underreported and happens every few seconds. The most dangerous place to live if you are a female, according to a WHO official. The apathetic society view must change for direct action and solution support for prevention, stopping the damage and injustice to humanity, draining society. What we've been doing so far, from my point of view, is putting a plaster approach. From my opinion, we are no better today than ancient times with slave trade, girls and boys exploited. Out of culture beliefs are part of the problem. It's a global issue, and long-term effects of broken physical, emotional, damaged people are underestimated and cost society billions each year. The cost and numbers continue to grow each year as no direct action or solutions are applied. We firefight. My aim with Joy Wisdom Trust is filling the gap with education, with a bigger platform of understanding, support and therapy solutions to help heal the pain and suffering, because we do need to do that, and putting a line under the event, getting people's lives back. We are looking to provide couples programs, preconception assistance, the solutions and support guidance for PND, PTSD, abuse education, because talking to people who have been abused, a lot of them say they didn't realize that they were. Learning more about mental health and the knock-on effect. We want to work with networks and charities. I would like to set up a legal framework so that women have somewhere to go with legal help, giving them the support to take action against their abusers. In March 2020, England and Wales stats said 1.6 million adults aged between 16 to 74 years had experienced sexual assault or rape. Analysis, it just goes on. And this is just England and Wales. If you take this to a global level, you can see how big the problem is. So we're going to have a look at some of the issues around maternity, how we can help women who have experienced challenging and difficult times during pregnancy. Not every woman is ready for pregnancy. Not every woman has that maternal instinct, can cause problems for them during their maternity. One of the things I noticed working with couples and maternity was an expectation to become pregnant straight away. The date was set, no thought of preparation or getting the body ready for new life. And couples leave pregnancy until later in life these days, which brings more complexities. And sometimes the body is not in the condition to support new life. Sperm and egg quality can be poor, and due to lifestyle, poor diet, etc., lack of minerals and vitamins can also be a factor. Drugs, alcohol, and smoking are factors of poor quality internal states, and also poor quality sperm and eggs. Disappointments are going to be involved when you have this weakness or poor quality involved, and it's going to take time to correct that. Some couples are looking, well, I want a quick fix, but the body doesn't work that way. You've got to remember that whatever age they are, this has changed and converted during that time. Alcohol is a big issue and affects both males and females, and of course the fetal origins are also affected. Sometimes we need a helping hand to prepare for pregnancy, and programs will be offered in JWT to help prevent disappointments. avoid the emotional distress. Stress and anxiety will be part of the picture from lack of success. The couples check inner body system quality needs to be addressed, and support programs for couples and individuals are on offer. Partners are emotionally affected too from miscarriage and at a loss of what to do to support. They feel out of their depth. We need both genders to look at this and to correct those changes, which can be done. Not all women glide into maternity and motherhood. Emotionally, many may feel out of their depth in pregnancy, and when the infant is born, can't cope with the whole scenario. Oxytocin, the love hormone, can be lacking between the mother and child, and bonding is missed. This can be a great impact on the infant and the parents, because if the bonding is missing, then the child will feel rejected, abandoned, insecure, and on survival. This is where the child or the infant can very quickly shut down and become very numb. So miscarriage, I lost my baby. And there have been quite a few celebrities that have shared their experiences on TV in the recent years. There is a DVD that I made back in 2014 about birth trauma and allergies. Miscarriage is not recognized as an emotional and psychological devastation for women. Data is poor, and there are millions of women that go through this process daily. A global issue. Their devastation is not supported or acknowledged. Most women push aside, advise to get on with it. However, all have their own stories of distress, loss, and grief. And for some, 20 years later, they can talk about this and tears will flow. The cause and underlying depression, PND, PTSD, anger, frustration, future outcomes and disorders from loss, grief, failure, etc. And some women do not recover. Trauma is too great. Couples are both affected from the loss. The partner or the husband feels the loss just as much, but they do tend to recover from the situation faster because they do not have the hormonal surges that women will continue to have. Some women shut down from distressing experiences. The hormonal surges keep the distress going. Pregnancy process, it has started and ongoing, and it doesn't matter if termination pill, the pregnancy process, hormonal surges will still be in place. This can be in place for quite a few months afterwards, sometimes longer, depending upon the woman and how balanced or dysfunctional her hormonal systems have been. It also applies to termination, stillbirth, and mum's grief can be absorbed into the next pregnancy. The bonding relationship can be challenging, and I've met many a person who has suffered this, where they don't feel anything for their parents, for their mothers. They didn't even know that their mother had had a miscarriage beforehand. The miscarriage sadness and grief can put that barrier between the mother and her ongoing children. The love of her life, occasion around the conception, can mean very different things at that conception for a woman and for the fetal origins. In some cases, you can have, I'm one of four, and my mother had more time and love for the youngest out of the four of us than she did for the rest of us. She lost twins in between me, my eldest brother. I think she was quite late into a pregnancy, so she was about 4 or 5 months when she lost them. I don't think she recovered very well from that. Obviously, it's in hindsight, but it explains a lot of behavior around favoritism around children and siblings, etc. Also, the relationship with the parents and behavior. The devastation of grief and sadness from miscarriage is vast. It is unique for the individual. Some women can seem to pick themselves up and so on, while others are just completely devastated. The shock and adverse trauma felt is misunderstood, and relationships strain can be very much involved. In my pregnancy and birth book, I have the story about one woman. The tally was about 10. This woman was grey, absolutely grey. The trauma challenges that she's had to face with that, and the grief, devastation. Her relationship had broken. She was very much on her own, but she carried that strain and loss for 10 pregnancies for her, working with her and getting some of this strain and stress off her. And she went into work the next day. As she walked in, they wanted to know where she'd been and what she'd done, because they said, I want what you've had, because she was a completely different woman. These traumatic elements that can weigh us down. It's as if we are carrying the world on our shoulders with little understanding of how it has arrived, how we have got to this point. So underlying postnatal depression and PTSD can remain from miscarriage, IVF, and maternity. We only think of depression as happening postpartum after birth, and research shows many women experience the same symptoms during pregnancy. Again, official data is very poor. Mood disorders such as depression, anxiety can occur during pregnancy or within a year of delivery, now referred to as perinatal mood disorders. Postnatal depression can be a long-term disorder from months to years, and many physical and emotional changes occur while we are pregnant. And after we give birth, up to 20% of women report feeling anxiety, sadness, depression, panic, frustration, and feeling hopelessness. Obviously, previous mental health issues will be a factor, but we need to acknowledge that postnatal depression and PTSD is common in maternity scenarios. Intervention, shock, trauma are causes. And of course, you will have, again, the hormonal imbalances. The post-traumatic stress disorder tends to come from when women are feeling out of their depth in the delivery process, intervention. And as one woman told me, she felt as though she'd been raped because she said no to intervention, but they went ahead and did it anyway and broke her waters. She felt very aggrieved and she had huge issues bonding with her baby. She said she liked her at 18 months, but she hadn't bonded with her. She didn't love her. These experiences are massive. The more we can prevent this, the more we will have happy children, because if you are not bonded with your parents, especially the mother, then you will feel depressed, rejected, abandoned, and causing ongoing mental health issues for us. And of course, it will grow as we grow into adulthood. In November the 1st, 2016, there was a study about rates of depression during pregnancy. Across Europe, 35 countries, and 1 in 6 women are at probable risk of depression that the antenatal study finds of Trinity University. Southern Ireland's rate was 16% of women being at risk of depression during pregnancy. That compares with the 34 other Organisation for Economic Cooperation and Development. They found that the rates were between 10 and 15%. In Ireland, they were higher. They also found that the depressive states increased in the 3rd trimester. Baby blues or postpartum blues affect 60 to 80% of all new mothers, often expressed as frequent and prolonging crying, anxiety, irritability, poor sleep, quick mood changes, and sense of vulnerability, thought to be self-limiting. I believe it is an overwhelmed, underwhelmed situation. Shock, trauma, and hopelessness feelings will come to the fore. It usually occurs in the first 3 days following birth and can continue for some women. Post-traumatic stress disorder following childbirth is usually triggered by trauma during the time leading up to, during delivery, or shortly afterwards. And the feeling either the mother's life or the life of her baby is at risk. I dealt with a lady. She had a good pregnancy and her birth went well, but she got home and she found that she had issues and ended up going back into hospital, obviously taking the baby with her because she was breastfeeding. She found the whole situation was very, very traumatic for her. The baby was traumatized. The baby needed feeding, but there was doctors and students in the room with her because it was an unusual situation. The nurse knocked on the door and said, "Can I bring the baby in because the baby's hungry?" And the consultant said no. Needless to say, that mother and baby suffered post-traumatic stress disorder. The little one started to live from her adrenals. She was so traumatized. And I worked with her after she was born. I saw her about 2 or 3 months old, and have worked with mum. PTSD, because she's had lots and lots of other issues, has remained underlying. Part of that was through an IVF process that she went through after she'd had this little girl. Ongoing from that, all sorts of problems that have followed her. Post-traumatic stress, severe post-traumatic stress, over and over and over again. But going through IVF processes will also create imbalances in the hormones, and they can be very extreme situations. And having worked with women on IVF and failed IVFs, etc., they have been a truly anguishing situation for the mother. Her ongoing health has been affected drastically. Contrary to popular belief, pregnancy doesn't protect women from developing mood disorders, and up to 15% of women experience significant anxiety or depression in pregnancy. Common symptoms include overwhelming sadness, feeling of hopelessness, excessive worry, rumination, and feeling of being overwhelmed, extreme changes in appetite, sleep, and concentration. Paternal and maternal depression is known to have a negative impact on how parents interact with their children and can have a long-term consequence if untreated. Certainly, postnatal depression, again, I've found with working with women, they are given the label of postnatal depression. But unfortunately, when I've been involved with them, I've found that they are just exhausted because they've worked well into their days of delivery, when, of course, when you have a new baby, there isn't much sleep. They have gone into acute and chronic issues around exhaustion. Diagnosis of postnatal depression, from my perspective, it has just been exhaustion. The levels of exhaustion that women will hold can be considerable. This came from a particular case of where I treated a woman with her second pregnancy. She'd had baby blues at the first one. The second one, she went into postnatal depression, which can happen. When I saw her, I treated her for postnatal depression, and that was full blown, and managed to turn her around. And the case study is in the pregnancy and birth book. She went on to have a third child, and again worked up until late in her pregnancy. Her third child was born. There was talk about coming to see me before she had the baby, but it didn't happen. Again, she went into what was diagnosed as postnatal depression. Eventually, I got to see her when I think about 4 months after her delivery. When I examined her, doctor had decided that she had postnatal depression. But when I examined her, I said, "It's not the same at all as you had last time. Everything is different." Of course, I had her notes, etc., so I could compare. Was absolutely exhausted. That was a relief to her that she was exhausted, rather than, and it made a lot of sense to her. She could put things in place. Her family could support her. She had good supporting family and husband. It's very, very different from first child to 3. When you have your first child, you can have your rest and take a nap when baby's having a nap, etc. When you've got other children to look after, 2 and 3, you haven't got that luxury. It can be really, really challenging for women. They do become exhausted, and quite a lot of women are exhausted before they go into labor. We can also have our own birth womb experiences by bringing irrational thoughts, experiences back in maternity. What I mean from this is, if you've had a challenging birth of your own, when you become pregnant, you can go into that default. It can bring about the feelings of feeling constantly tired. We cry, we feel panicky, we worry excessively about our baby's health, have a lack of feeling for the baby on the other side of the coin, or have difficulty sleeping or eating, problems concentrating, frightening thoughts or fantasies, feel overwhelmed. And that sense of loss, feel like running away, don't feel like myself anymore, feel failure as a mother. There can be a real big mix here, and it doesn't only just happen to the mother, it can also happen to the father too, where they have experienced challenging births, and when they have start a family, they can have all of these issues coming up, and they can go into postnatal depression. Affects both parents here. They too can feel very distressed, feel out of their depth with a challenging birth or miscarriage, etc. Again, they can default to these experiences. It will come back to the fore. Memories don't go away. Underlying depression and anxiety can be transferred to our infant from fetal origins, from the womb, and living with underlying issues from the womb, even in adulthood. We then live it as normal when abnormal, and the depression or anxiety can be inherited. Obviously, we can create more of the same in life and live the status quo. It's not just about pregnancy. It's about allergies. It's about women's health, how they are in pregnancy, other issues such as candida, etc. It has a very large index. So post-traumatic stress disorder can be underlying and undermining life from adverse experiences. A large number of society lives underlying PTSD without knowing or realizing, and starting early, it can be transferred from parents to the child in the womb. Even in the home, if you have somebody who is depressed, anxious, etc., we can be affected by it too. We absorb the negativity that is produced. We feel that. And formed from PTSD means life is meaningless, under or overwhelmed from life. And it doesn't matter how much money you have, how comfortable you are, life will be a disappointment. Shock causes anxiety and depression, weariness. It wears us down. Overwhelm, underwhelm, and shut down. It really does affect our energetics that support our physicality, and everything starts to go down like dominoes. If we are living from aggression, rape, and shocking environmental trauma, we can accumulate shock daily from media, one-to-one interactions, and pick up from the supermarket. And fears makes us numb. We then have this shell of soul or shell of life living, and it breaks us at a core. It, again, it's like a fog that sort of overwhelms and really takes over. People with depression say they feel that they are in a long tunnel. This is why, because the energetics have collapsed around us and can't support us. PTSD will be especially first-line providers such as police, ambulance, medical staff, social service, fire services, migrant workers, peacekeepers, military. They will all be suffering from some form of PTSD. Of course, there are huge elements and varying degrees of shock and PTSD, and it can strike years after the event. I heard a story on the radio one afternoon about a peacekeeper. He had been in one of these war-torn areas, and he had come back. He was fine when he was out there. He came back, and 2 years later, he just fell down like a ton of bricks because the PTSD hit. The more he relaxed as he came home, the more this took over. This is what we can do. We can cope with the situation, but then it hits afterwards. It can be severe to shocking levels of PTSD. Car accidents, viewing or observing may be instant. A child can suffer PTSD from birth, trauma, lack of attention or neglect, and severe levels of horror of the Holocaust, war survivors. Extraordinary levels of PTSD are lived and frozen in time. It becomes like a great iceberg that people live in, or concentrated with post-traumatic stress. PTSD can be underlying and undetected as normal feeling and scenario for individuals. We get that we become suppressed, oppressed, and repressed. And over time, we don't even realize it's happening. From a JWT view, PTSD is misunderstood, underestimated. It will be passed on to future generations via the womb, DNA, and transference. And as Israel trials have proved with Holocaust victims, from my own experience, working with babies and adults, and anecdotal evidence. I've found PTSD from grandchildren of war veterans from World War II. The war-torn victim has suffered drastically from PTSD, become an alcoholic, in fact. It didn't touch so much the child, the parent of the grandchild, but the grandchild had it full whack. Levels of PTSD, and he had lived that from a very early age. And we tracked it back to the grandfather. He had been Polish and he'd been in a Nazi war camp. Horrific experiences. And that PTSD that was lived was so great. And this is the dominance that then is carried forward. And it does miss generations, but it will continue. Abuse is a big subject and a cancer in our society from my point of view. And it's time we dealt with it and time we put a stop to it. I am very passionate about women and children's health. Neglect and suffering continues for women. All types of abuse is accepted as part of life in our society today. And some cultures condition their women to live suppression and repression, handed down as acceptable when it is not. Abuse is a complex and vast subject and has many parts to find. It's a global issue. It has raged havoc throughout the ages. Historically, abuse has been a core level of power and control. All levels of abuse are still in motion even today, and very little progress has been achieved, even though we have passed laws to protect the innocent. Little judicial outcomes, and victims are perceived to be the cause. We can find it in the home, the school, the office, and the street. The age of abuse has been going on for centuries. Worse outcomes to be female in different parts of the world. Culturally, we are trapped in ancient beliefs and traditions that continue to condition and brainwash through tribal thinking, religious out-of-date practices, promoting daily abuse to women and children. Essentially, where we are born will dictate our outcomes around abuse, rape, early marriage, and sexual harassment. Logically, we would believe that life and learning would result with a different approach and outcome. We are left wanting in the 21st century, as abuse is just as strong as it was in the 2nd or 3rd century. Approximately 85,000 women and 12,000 men were raped in England and Wales every year. And that's roughly 11 rapes every hour. And that was 2014-16 stats. As you can imagine, those figures have grown tremendously. 2015 stats showed 1 in 3 women worldwide had experienced physical or sexual violence, mostly by an intimate partner, whether at home, on the street, or during war. And violence against women is a global pandemic that takes place in public and private places. It's appalling numbers of suffering applying in the world, and the extent is underreported. Data is misleading at best. Exceptional challenges exist for women and children from abuse. Certain parts of the world, extreme occurrences happen. With the cancer of society, perpetrators are not punished and go on to bully and abuse. I talked about this in 2014. It's on the website. It's on YouTube, and physical and mental health issues are inevitable from all types of abuse. Abuse is abnormal, and we really need to start thinking this way. In UK, women are abused every hour. No numbers are not reported. We can have broken and damaged victims live in terror and fear, and human rights is abused. Some take their abuse to the grave. Relationships are challenging when abuse is involved. Self-esteem, will, and choice is reduced, and long-term health damage is unsurmountable and not acknowledged. Apathetic society thinking must change. Data means nothing. Education and therapy solutions are required to help individuals out of the injustice horror they live, to get their lives back from injustice. Perpetrators mirror what they have been conditioned to in home and environment, and they can be victims too. They are taught aggression, bullying, and abuse. Watching porn is conditioning to abuse, and perpetrators may be victims of abuse themselves and don't know any other thinking. Trauma bonded to the act of rape, believing sex, violence, and rape is love. Numb, they need the stimulation of rape to feel. And some of these conditions will be formulated from neglect and from lack of bonding from an early age. None, they need the stimulation of rape to feel. One woman told her story: when he came at me with the machete, I realized it was not love. So we need more education to teach people what abuse is, teach them to recognize the signs of suppression, repression, and control. School, universities, home education is required. And abuse is subtle in its methods. Undermining, grooming, a factor. And grooming is used to manipulate innocence in all sorts of ways. The cat and mouse games. Abusers get their kicks out of watching their victim break. Ownership, control, and bullying is their goal. They're cowards underneath, vulnerable. Early neglect, lack of bonding can be an underlying factor, and issues from their own youth. And of course, this covers all creeds, status, cultures, and ages. We had Tina Turner as a prime example, who discussed, she wrote a book. She was very brave in writing her book. And they went on to make a film of how she was treated with domestic violence, etc. The manipulation that went on. The thing about violence is that causes chronic illness from adverse trauma. It has its roots in cancer, bladder incontinence, diabetes, heart issues, and inflammation, fatigue, exhaustion. And it saps life, it shortens life expectancy. And in the ACE trials of 2007, they identified that adverse childhood experiences, that's what ACE stands for, can shorten life, and went on to cause chronic illness such as arthritis, etc. I had the very good opportunity to work with some terminally ill cancer patients. I asked if I could do some sessions with them, and 6 of them agreed. What I noted from their consultation forms and asking them questions was that they had all come from domestic violence backgrounds. They were either involved in receiving the domestic violence, observing it, or in the environment of that, watching others having domestic violence. And that was very revealing to me. If we could stop abuse, if we could stop domestic violence, people would have better health. If we could help to treat them, to remove the emotional impacts, they would then go on. In a lot of these cases, it was in childhood for each of these cancer patients. The other story about the refugee, a practitioner of DARE had the opportunity to work with a woman that had come, refugee from Africa, and she had been 4 years at this hospital. She'd been through every department. They could not help her. She was still very, very traumatized, etc., etc. And they said, come and work with this woman. She didn't speak English, so there was no interaction or conversation. The woman came in, she lay down on the bed. We knew that she had been gang raped for many months, and her children had been made to watch those rapes. Physically, she was a broken woman, and she had lots of issues with bladder incontinence and gut issues and so on. The practitioner worked with her, getting her, using her DARE methods, getting the trauma and shock off her. The woman felt in the body, you could feel in the body her starting to relax. She only had 2 sessions with this lady. From her background, she would have needed at least 10 sessions. 4 years she'd been through every department. Bladder can be a huge issue for women from rape. And of course, as we remove the emotions, etc., the bladder can then return to normal. And we have done this with people. We hold a lot of fear and trauma in our organs. With the second session, the client walked into the room and smiled for the first time. They hadn't seen her smile before. She was standing taller, she was standing straighter. DARE really does help with self-esteem, self-confidence, and allowing us to heal these terrible injuries that we have endured. So one statistic in adverse childhood experience, the ACE trial reported, women who'd faced 3 types of childhood adversity had a 60% greater risk of being hospitalized with an autoimmune disease as an adult, such as ME or chronic fatigue syndrome. And similar links existed between childhood stresses and adult heart disease, diabetes, migraines, irritable bowel disease. And suffering 6 categories of early life stress shortened one's lifespan by 20 years. What a difference we could make to people's lives and their longevity if we can reduce these impacts. One of the very sad things is that very often abuse will start when women are pregnant because the perpetrator feels pushed out. They aren't the center of attention. Of course, they have their own vulnerabilities, as we've talked about. Many a woman is punched while she is pregnant. That isn't going to do her or her baby any good. I would really like you to send me your stories and share experience of help. We don't have to suffer in silence, and a helping hand is outstretched to get your life back to live with grace and ease. Programs for education, group discussion, therapy applications will be available to help remove and eliminate suffering memories that plague us today. Even 30 years on, we can be suffering from underlying depression, miscarriage or maternity, grief or PTSD. You can send text, email, video, audio messages, and do contact. A long time ago in my reflexology days, starting my pediatric craniosacral training, I was sat with a group of women, and there were about 15 of us. I asked the question, what sort of birth or labor did they go through? The emotions that filled the room was untenable. It was quite shocking. The pain and the suffering from that birth, from that labor experience, was still very, very much part of them. Some of them got very emotional. Out of those 10, 12 women, they all had their story. They all carried those wounds. And we really do need to help them to remove that, because health-wise, it's not going to do them any good. If you would like to assist with Joy Wisdom Trust, please contact. If you would like to register as a practitioner or become a friend of JWT, if you would like assistance from PTSD or things that we have covered today, please register on the website form. Donations are welcome. You can see the website for details. Looking at some of the questions were about children who have been affected and so on. Looking at it from the bigger picture, if we can help women and support women and reduce the distress of women in maternity and from abuse, we are going to have healthier and happier children. So we're going to be slowing down the issues that children are living with, and certainly depression that can come from the womb. It's natural and logic that follows through that if a woman is depressed in pregnancy, then her child is going to be formed from that. And we really need to take that on board by helping to reduce the depression of the woman, supporting the women in pregnancy, miscarriage, etc., or from abuse. Then we have a better chance of helping children and stopping the decline and ongoing mental health issues that are growing every day. If you're interested in Joy Wisdom Trust, what we stand for, if you want to help, if you would like to get involved or even take part in some of the programs, please contact. Our website, as you can see there behind me, is www.joywisdomtrust.org. Please share your stories and contact for more information. I thank you for your time.